You're listening to the WCEN podcast. Hello, everybody. I hope you're doing well today. My name is Peeks, and you are listening to the WCEN podcast. Now, the reason for this podcast show is to keep the communities and multi-faith networks informed on services, how to access them, and to keep your spirits uplifted during this global pandemic that's going on right now in regards to the UK lockdown. So we're going to be speaking to a variety of people from various professions and backgrounds, people who are members in the community, faith leaders, people who work on the healthcare professions, just various job titles that are going to come on here, share their experiences, share their services in regards to what you can still access during this kind of time. So on today's show, we're going to be speaking to Darren Fernandes from Epsom. He is an Associate Director of Transformation. So Darren, are you there?
Hi Pete, how are you?
I'm good, but how are you today?
Yeah, well, thank you.
Right, good stuff. And so I've just given everybody a brief introduction about yourself and about your job title, which is obviously Associate Director of Transformation. I've never heard of that before, so maybe other people haven't. So it'd be great to just get a bit of background information on yourself, where you're from, and just everything kind of leading up to this, just before the UK kind of lockdown, and kind of how that has affected your kind of like services and stuff. So if you could just give us an overview about who Darren is, that would be great.
Sure. So where should I start? So probably a bit of background about me. So I was born in South London, Tooting, and lived, I think, the first 25 years of my life there. So I'm very, Wandsworth is an area obviously very close to my heart, and I lived there for a long time. Grew up there, schooled in and around the area, went to college there. After that,
What did you study in college?
College, it was the sixth form, and then I went on to university. I did a degree in economics at Reading, and then a management master's at Imperial College after that.
Oh, wow, Imperial College.
And then after that, I actually didn't want to work, so I just kind of traveled a bit. I lived in India for a while, 6 months, 7 months, just relaxed a bit really before I started in the world of work.
So what led you to decide that you wanted to go to India? What was kind of the motivation behind that, and what kind of things did you learn after coming out of some intense studying?
To relax, so my family's from Goa in India, which is quite a relaxing part of the world.
Okay.
It's a beach resort. There's lots of people are laid back, and I've got lots of family there as well. So I went there, lived out there just to kind of experience the lifestyle more. Mm-hmm. I've always gone back every 2 or 3 years with family, but I just thought I would live there just to see the kind of day-to-day living rather than holiday kind of experiences. And I had a lot of friends who were also kind of just relaxing out there, mm-hmm. spending time just kind of chilling. So I thought I'd go as well. I had nothing else. I thought was good. And that was it really, just to relax, connected with more family on a more kind of one-to-one level, built, stronger relationship.
I mean, where did your kind of career start? How did that kind of grow, and then to kind of what leads you to where you are now?
So my first job was working at Sainsbury's when I was 16. So I worked in Sainsbury's, Collier's Wood, for about 6 years, I think, 6, 7 years, mm-hmm. Just stacking shelves. And then obviously went after my studies. I was working up until the end of my studies, and then went to India for a while. When I came back, I just started doing some admin work. Mm-hmm. I was doing some admin work for a while, just some agency admin work, just to kind of get into the workplace, because it was quite difficult to get any kind of roles without much experience.
Right.
I did that for a few months, and then I landed a role doing some marketing for a company in Mayfair, Green Park. And I worked there for probably about a year and a half, doing kind of their marketing and advertising. And during that time, I felt quite ill. Okay. So I was hospitalized for, I was probably like 4 weeks in total, but I was in hospital for 2 weeks, just like sudden illness. And during my time in hospital, they made me redundant. Mm. So, and this was a company, I was quite young and naive at the time, but I'd given my all to this company, and I'd even kind of taken out loans and under my name and lent them money to keep the business afloat.
Oh gosh!
And then at that point, they made me redundant. I was shocked actually, because I had invested so much time and effort and also resource, I suppose, and put my neck on the line to help them out. And they kind of just, weren't interested really. It was all about business.
Gosh.
And at that point, when I was in hospital, I just thought I either want to make money for myself or work for a non-profit organization.
Mm-hmm.
And I was really clear at that point, because of my experience, that was what I was going to do. And then at that point, luckily I recovered. And after about 6 months of fully recovered, I applied to do some administrative work at Springfield Hospital.
Mm-hmm.
And I started kind of just doing some agency admin work, some data entry. And then I was lucky. I applied for a few roles, and I got my first role as a medical records manager. I was kind of managing a small team of 6 people with all the kind of medical records. And in those days, a lot of it was on paper. Not all of it was electronic. And then started doing more work, and then applied for a few different roles after that within the organisation, and moved on to kind of working in performance management, where that was kind of managing teams' outputs and performance and see if they're meeting some of their targets. I did work around information governance, so that's kind of managing our information and confidentiality. Then I started managing services. So the IF service I set up in Wandsworth back in 2008. So I did a lot of work there, kind of service managing with a team of about 70 staff. And, some of the listeners will know about improving access to psychological therapy, or IF, and the work we're doing with communities. And that's all set up with the work I did with WCN and other partners back in 2008. So I did that role, and I also managed community development workers. I know we had a few in Wandsworth that were working really closely with us. So I managed that kind of area of work for, I think, 7 years. And then there was a restructure at work. Sorry, I'm going on a bit.
That's all right. You have an extensive background, so it's really interesting, obviously.
And then moved on to kind of working more corporately around involvement and working with service users and stakeholders in co-production areas, more of a strategic level and less so on the ground with operations. And then did more work around strategy work in the strategy department, and then moved on to this role, which is the Associate Director for Transformation. Mm-hmm. And what that actually means is looking at how do we transform and change all of our clinical services to make sure that they're fit for purpose, they're kind of 21st century, we can deliver it in the 21st century. Our pathways are clear, our processes are clear. We reduce health inequalities and improve access. And we know that there's huge variation across all those domains. So my role is to try and change all of that strategically, along with us having more services and support in the community to let people get admitted into our wards.
Wow. That sounds like a very big task, a very big job. I mean, so in terms of, this going into this lockdown now, which is like 2 months, 8 weeks or something, going into 9 weeks or whatever. I mean, it just feels like forever, I think, for a lot of people now, but it's been going on obviously quite extensively now, and only now we're just recently getting news of it kind of maybe starting to kind of ease up maybe in the England area. But if you can tell us, as the lockdown kind of happened, how did that affect your business, and how is it, how are you adapting to things now?
Yeah, so lockdown's been really challenging, I think, for the NHS, and even in mental health where I work. So we went into more of a kind of crisis management scenario. So we were only, admitting people who really needed support on our wards. We were providing a lot more interactions with our community teams. We developed a number of kind of an emergency ward where people could come to if they needed support, as opposed to people going to A&E to kind of reduce the burden there. We opened a 24-hour, fully functional mental health support line to support anyone in a crisis. So we did a lot of quick initiatives to add resource and support people who were unwell or in a crisis, to help reduce some of the pressures on our A&E departments in the general hospitals and try and free up beds for COVID.
How busy did it kind of get? Did it take you by surprise, or did you feel like your
No,
strategy was quite...
we were planning for it. So we had less people on our wards, actually, than normal. And I think that was partly because people weren't going to their GPs or going to A&E for their mental health or well-being. They were more worried, I think, probably about the risk of COVID. So people were trying to self-manage and keep well. And they'd rather stay at home or get other support than potentially come into our wards. I mean, that's just a theory, but that was one of the theories why we had less patients on our ward during the time. But we've seen that number starting to increase now.
And why do you think things are starting to increase now, or is there a reason behind that?
Yeah, well, I think with some of the easing of lockdown, people are feeling less anxious, maybe about leaving their house or going out or going to see their GP. But I don't know, I think the risks are still quite high, generally, for everyone, because numbers haven't gone, are fluctuating still. So, I mean, there are mixed messages out there from the government as well. So it's really difficult to know what you should or shouldn't do.
So how do you keep in terms of the guidelines and things like that that's happening? How do you kind of keep informed about it, and how do you kind of keep people's patients and everything kind of moving along with business?
Yeah, so I suppose in our clinical teams, we exercise social distancing. We do as many virtual consultations as possible, and then we take whatever precautions necessary when dealing with service users who might be COVID positive. We've obviously got PPE equipment if needed, and we use that regularly when required. So we're taking all those precautions, and obviously very seriously, and we get guidelines obviously from central government around any kind of changes that are imminent or are going to be implemented. And then we need to interpret those and manage those accordingly. So the kind of landscape changes quite quickly and at pace sometimes, and we just need to be as fluid, as flexible as possible to kind of meet those needs.
So in terms of the BAME community, it's kind of coming to light that obviously that there's a higher death risk there with this pandemic and everything that's gone on, and obviously with people as well, and the service, the people who are providing the services as well and stuff. So, I mean, I don't know, in terms of your experience and what you're seeing, is there any kind of light that you can shed on that? So people from the BAME community, or maybe people who are from maybe more deprived areas and stuff, what's your kind of experience or take on that?
That's a really good question. It's a big question. I don't think I can, I suppose, answer it fully, but I'd have my own views, obviously, around it.
Yeah, just with your experience and what you're kind of seeing develop.
Well, there's a number of theories. I know people are probably quite well versed around what they are, and there are things around BME communities might be living in bigger households. BME communities are more on the front line in terms of some of the roles and key worker roles, so like nurses, bus drivers, working in retail and supermarkets. There's a lot more BME people working in those roles, so they might have more exposure to it. We know there's significant health inequalities in the AME community, and if you do have underlying health conditions, you're more likely to be at risk as well. So that's another factor. Also, there's I think part of the issue around living, socio-economic factors of living in areas that are more deprived. So you're kind of more densely populated. You're more likely to come in contact with people. If you live in a block of flats, how it's difficult not to past people if you're going to the shops or what have you. And I think some of the data shows people who live in less densely populated areas are less affected in that regard. So I think there's a multitude of reasons, and there are a few. And another will probably be information, I think, and sharing of information, and people understanding how serious things are. I go out sometimes and I see families walking around supermarkets and shopping with young children, older children all together. And, they don't necessarily need to do that to reduce the risk for themselves and everybody. So I think part of it is understanding the real issues and what really, and how strict you should be with some of the guidelines that have been given and adhering to them. But also, I think, if you don't have the garden space, you need to kind of get some fresh air, some exercise. You can't be cooped up in a house or flat. It's really difficult for your well-being. So I think it's difficult, but we do know health inequalities have existed for years for BME communities, and I think that's fundamentally what shines the light on. We still haven't been able to crack that.
And coming out, I mean, there's starting to be talk of some easing in some places, I guess, as we said, in England, which has just recently started happening now. What do you think of this kind of exit strategy, and how does it affect your kind of like business? How do you kind of foresee things that can be done safely, for yourself and for the service users?
Yeah, well, I think the messages are unclear around what you can or can't do. I think you could kind of meet a person from another household in an open space, but you can't meet two people from the same household in an open space. And then you can kind of, kids are looking like they might go back to school, so I suppose you would probably be exposed to, they would have exposure to a lot more people who might have exposure to COVID, and then you'd be in contact with those people. So I think the messages are really confusing, and I don't understand the government's strategy around it. And I also think people are obviously eager to get out and do more things. So in terms of NHS business, we are starting to see more people now coming into our mental health services and inpatient wards. The numbers are creeping up. We are expecting a surge, and we know there'll be a huge impact on people's mental health and well-being during this period. So we are expecting numbers accessing all of our services to increase. So we're doing preparations around increasing our resource to be able to manage that over the next few months.
So in terms of the mental health, is it away from the virus that the mental health is actually being caused, or is it due to all the circumstances of people worried about their jobs or being locked up or abuse in relationships and things? What is it you guys are kind of seeing now with maybe the spike that's about to happen?
Yeah, I think it's all of it. So, people are worried about their jobs. People might not be able to pay their bills. I suppose living with people 24 hours a day, 7 days a week can cause tensions as well within families. So that's difficult. We know the numbers of domestic abuse are also increasing. People are also isolated as well. That isolation is increased by not being able to even go to the shops if you're vulnerable, if you're older. Lots of people are lonely as well. And all these factors are significantly impact your mental well-being. So we're starting to see all of those kind of conditions, I suppose, are starting to pick up and be presented to services.
So, I mean, your work with WCEN, you've worked with them over many years, and you have done some great work, I mean, within the community and enabling them to be able to do services and things themselves. How important do you think, if you can explain to us what the WCEN partnership is that you have and what you've been contributing with that, and how important organisations like that is in terms of getting things at the grassroots level, especially to people from BME backgrounds and stuff?
Yeah. So, as you said, I mean, we've worked with WCN probably for 15 years, something like that. Wow, so it's been a long partnership. And obviously worked very closely together on a number of projects like IAPT, and we're doing a lot of work now on our MHIP project, which is the ethnicity project to look at how we reduce mental health inequalities. There's an overrepresentation of BME people in mental health services, and looking at actually what do we do that's very different and more targeted and bespoke to reduce those numbers. We did a lot of. It's taken us a long time to get to that stage in MHIP, which is Ethnicity Mental Health Improvement Project, that's what it stands for. And we've got a number of professionals and experts working with us on this, such as Professor Sashi, Professor Frank Keating, Dr. Rochelle Burgess, and others, to kind of address this work. And I think it's essential that we continue work with grassroots organisations. If we don't do that, if you don't fully understand the local needs, your ears, I think, need to always be to the ground to understand what needs to be done, and then being able to respond to that. Mm-hmm. And that has to be a respectful response that's collective. So I think it's been really, WCN's been doing a lot of work during COVID with a lot of BME communities. And historically, a number of BME communities don't get necessarily the support, or they don't have the infrastructure to be able to understand or to work with some of the things that need to be done, or potential funding that can support their communities. I know WCN's done a lot of work. We're trying to get some of the grants during this crisis period to enable communities to support their communities. Does that make sense? Mm-hmm. So I think absolutely essential, and the work needs to continue, and continue to be structured and more, and organisations to continue to be more empowered to carry on doing what they're doing.
So the MHIP project is that for communities, is for people to access, or is
Yeah, so the MHIP project is a collaborative piece of work between South West London and St George's Mental Health Trust, that's us, WCEN, and local community partners, mm-hmm. So like New Testament Assembly Church, Muskelaton, and others. And the idea is that it's an inside-outside approach, so we take the best information and evidence we have about projects that work within the NHS, take the best evidence and practical initiatives that work best in the community, and combine them to look at what would be the best offer and service that we can provide to reduce the overrepresentation of BME people in mental health services. Historically, there's been a lot of kind of theory and a lot of papers done on it, or initiatives that have happened that have been good, but have not made the difference you want to see. Mm-hmm. So this project is looking at actually how do we combine both the inside equally with the outside, so communities and statutory agencies together. And I think that's the fundamental difference. And we've done a lot of work so far, and there's a lot of work to do going forward, but it's going well at the moment in terms of progress.
Excellent. And obviously you have your conferences as well, and Heal Our Broken Village, where a lot of you share kind of what's been going on, how you're going to break it down, and accountabilities and all that kind of stuff. How do you see that kind of moving forward or developing in the wake of, what's kind of happened now with all these new kind of guidelines and things? And do you feel
it's very interesting question. I suppose at the moment it couldn't happen. In terms of meeting people, that many people, 500 people at conferences we have plus. So I think come October, when the next conference is, we'll be in a different place to where we are now. So I think social distancing, will probably be in place, but in a different way. So I think people will be allowed out more to meet and connect. I think the impact will be that there'll probably be more virtual or webinar type sessions potentially. Mm-hmm. And then we know in BME communities, the kind of connections and relationships are really important, and meeting and talking face to face is essential.
Yes.
It's essential in terms of communication and understanding what's going on and listening to people. So I couldn't answer that really. We just have to wait and see how it pans out over the next few months. But whatever happens, I think taking away that one-to-one relationship connections with people is difficult to run any kind of conference going forward from that because BME communities operate very differently.
Yes, definitely. And so it's obviously going to be up to how these guidelines progress to see how things are going to be going on. But obviously, a lot of people are, as you said, implementing virtual things. But hopefully, that's just for a time, as everything gets eased back into.
Yeah, because then and also it's then difficult if you've got a large conference. How do you make your connections and relationships with other people? Virtually, you can't really do that. How do you get a sense of what's going on, a feeling of the the conference and the kind of atmosphere in the room? You can't really virtually. It's quite difficult.
You can only fit so many people virtually, I guess, as well, and to get feedback and all that kind of stuff as well. So, we'll definitely keep us posted on all that work. If people wanted to find out more about that work, what's the kind of, is there anything in place where people can find out more about that and obviously the services you're offering?
Contact WCN. They will have all the information on the email address or on their website, info, I think, at WCN.
What's the thing that's kind of impacted you the most, would you say, maybe professionally or personally yourself as well? And how do you kind of see things, moving forward? Has your kind of views on life changed, or is it kind of the same? Where do you kind of stand now that this has kind of happened on a worldwide scale?
Well, I think people are reconnecting with their communities, their local kind of communities a lot more. Mm-hmm. A lot of people are speaking and looking out for their neighbours. I think that hasn't always happened. I think there's been a bit of a disconnect with that kind of community spirit, and I think that's really come back. I think that's been a real positive. I mean, neighbours are speaking to neighbours they've never seen or even spoken to before, which I think is a really good thing. And people looking out for each other. I mean, it's human nature, but it's good to see, and it's warming to see. I think COVID's here for a while, so I think at least a good year or so there'll be some types of measures in place before we kind of get back to perhaps where we were. But then saying that, I think the world's changed a lot now. So in terms of working and connecting, I think people are doing that a lot more virtually. I think people are finding they can work at home more and quite easily. You can have more of a work-lifestyle balance. You can probably connect if you've got family more, so you spend more time at home and speaking and having conversations and more quality time. So I think that helps bond families together. I think people are connecting with people they don't normally check in with. You might have friends, you can connect with or family once every year or so. But I think during this period, people are making more of an effort to kind of check in with family and friends who they don't normally do so regularly with. So I think that's a real positive as well. Mm-hmm. But of course, there's negatives as well. So, people are, losing jobs, or people are worried about their jobs and no one quite knows, depending what industry you're in, people are at more risk of losing jobs, or their income's going to be significantly reduced. So I think that's going to be really difficult to manage for a lot of people and a lot of families. And navigating through that will be difficult, I think. So I think we need to start thinking generally as a country how we support those kind of industries differently, hospitality, others like that.
So, I mean, lastly, sorry, go on.
Yeah, that was really it. So it's worrying but positive at the same time.
Yeah. I mean, with all your experience and obviously working with the BMA communities on the community levels, with your professional levels, and working with all these other great people, as you said, with WCEN, Sashi, Dr. Burgess, and things. What's for people who are who are maybe suffering from mental health, or you can see, what's kind of laying ahead of you in terms of services and in terms of people who are at home and who are maybe going through mental health issues. What would your advice be? Because obviously there's still an extension. It's not eased up everywhere for everybody, and it's still going to be extended. So, I mean, in terms of people professionally, or people who need to access services, what's your kind of advice to kind of keep going and just staying in a positive light, basically?
Yeah, I suppose if you need help and support, access it, because the services are there to be accessed. If whether it be your GP or mental health services. If you need it, contact the relevant people, and you'll get advice and support whichever way you need, because it's essential that you do get the support you need. So that would be my first kind of bit of advice: is don't not contact anyone. Make sure you contact anyone as you normally would, and they will arrange either a consultation, telephone calls initially, and then if you might need face-to-face a consultation or an admission, that will be facilitated. And secondly, I suppose there's a lot of things you can do to try and maintain your well-being. So connecting with people regularly is good, whether, virtually. Having conversations is important. Try and learn something new, or a new skill or hobby. Make sure you exercise as well. It's really important for your health and well-being, whether it be in your house or in your garden, on the street. Try and get out at least once a day to do exercise. Keeps your mind fit and well. And eat healthily. I'll say, it's a great. People are in now. People are cooking more. That's another positive. So just continue to, experiment and use lots of different vegetables and fruits, and eat as healthily as you can, because that keeps you well as well.
Definitely.
So I'd say those would be the key things I would suggest.
Mm-hmm. All right. Well, thank you so much, Darren. There's a lot of information on there. Is there anything else that you'd like to say before we wrap up?
I mean, it's been great talking to you and on this podcast. And if people do have questions or want to get in contact with me, you can do so through WCN. That's not a problem, really. So, and just a message to everyone: keep safe, keep well.
And for you yourself, keep well, Darren.
And
thank you. And we'll maybe have you back on again and just see how things are progressing during the whole course of this. So continue on with your good works, and we will speak to you soon. Take care and have a good day.
You too.
Thanks, Darren.
Thanks. Bye.
Bye. So that was Darren Fernandes. So thank you so much. He left some information there. We'll drop it down below if you want to get in contact and keep up to date with what's going on there. If you want to leave any tips, suggestions, or experiences yourself, then you can do so on the comments down below. Alternatively, you can email on info@wcen.org.uk. You can also go and check out the website, where there's resources on there as well, and information about what Darren spoke about. There's also where you can sign up to the newsletter, and then you can be kept up to date with lots of other useful resources and when the next podcast shows are going to be out, and that's on www.wcen.co.uk. If you want to find out the latest government healthcare guidelines, then the best place to go is www.gov.uk or www.wandsworth.gov.uk. If you find this helpful, then please do share it with somebody else. Like, share, and subscribe. We will catch you a lot soon, and please stay safe and stay well. Take care of yourselves. You're listening to the WCEN podcast.